Contraceptive, in simple term, is also known as birth control. It can be defined as the use of device, drugs, or surgery to prevent pregnancy. Like basically, the main purpose of contraceptive is to prevent pregnancy. Let me just list them out. We have the barrier methods, we have the hormonal contraceptives, we have the natural methods, where you have the pills, you have the injectables, and you have the implants.
Is Postino under this one?
Yes.
That drug has seen
Postino is under the pills, hormonal birth control.
That drug has seen shake in this country. I know there are so many different hormonal contraceptive, but let's mention this one, post-pill. The one that the most common one is like Postino. Let's talk about Postino. Like, I just want you to shed more light on, especially what it does and how it should be used. Because I don't understand why one of my neighbors, she might see this, keeps on taking post pills like on a daily basis. She wakes up in the morning and she uses that to wash her mouth. So please just throw light on that.
Many ladies feel post pill is the ultimate protection. Some of them just after I'll use post pill. You don't know that aside from preventing pregnancy, you also have to protect yourself from STIs. We have the fertility awareness method and we have the withdrawal. Okay, under the fertility awareness method, you can use the calendar, you can use your past menstrual cycles to be able to know when you have ovulation, when you're ovulating rather. Okay, so a woman doesn't she's usually fertile 5 days before ovulation, on the ovulation day, and 12 hours or 24 hours after ovulation.
So for the withdrawal,
you can do withdrawal actually.
See, it's a contraceptive method, no doubt, but it has the highest failure rate.
Exactly.
I'm not saying you should try this, but you see it on maybe like movies. Do you know what it means jumping out from a moving car? Do you know how much you have to time it to perfection?
Because once
even people that act, they have stunt directors around them that tell them when to time it to perfection, and then there is you and they bleed. But it's not a method that you should rely on. It's not a method. It has like something percent accuracy rate, meaning that for every 10 men that use it, it will fail 3 men. If for whatsoever reason your wife cannot use a certain contraceptive option, as a man, go and use condom. Stop saying you like it raw, that you enjoy it when it's skin to skin. Help this woman to help you, because if she has an unplanned pregnancy, it's still going to affect you. You know, we're looking at baby things now. I was watching a skit yesterday. Oh, more baby things cost though. Baby things cost.
Meal.
Help yourself. Hello everyone, it's another episode of the Intimate Matters podcast, and we're glad to come your way again. And as always on this podcast has been put in place to take you on a deep dive into the world of sexual and reproductive health, and we discuss issues that pertain to your sexual and reproductive health, and we hope that you learn from it and use it to make informed decisions. And as always, today we'll be talking about a very intricate matter, something that has become very obvious and very important that we discuss about. And as always, I have an amazing guest with me in the house. With me here is an amazing pharmacist, Ada Kamalu. Ada, thank you for coming on the show.
Thank you for having me.
All right. So today, I'll be sitting with Ada to discuss the issue of contraceptive. Some call it family planning. Basically, contraceptive, it's something that is affecting everyone. You go around and you hear a whole lot of stories about people abusing contraceptive, especially the young ones, the Gen Z, abusing contraceptives, taking it as they should not take. But just before we get into it, what is it? What could qualify as a contraceptive?
Okay, contraceptive in simple term is also known as birth control. It can be defined as the use of device, drugs, or surgery to prevent pregnancy. Like basically, the main purpose of contraceptive is to prevent pregnancy. Although some of the contraceptives like condom can be used to prevent STIs, that's sexually transmitted infection, like the gonorrhea, syphilis, HIV, and the rest.
All right. So I love the way you put it, because when we talk about contraceptive, a whole lot of people look at it as drugs. So you talked about drugs, you talked about devices, you even mentioned surgery that is used to prevent contraceptive. So before we get into you to expand that, why do we think that contraceptive or birth control, as you said, it's important. Why talk about it or why use it?
Okay, first of all, the major reason for contraceptive, like I said earlier, is to prevent pregnancy. Okay? To prevent pregnancy, like people use it for family planning, to be able to know the number of children they want to have and the spacing between those children. Also, people use it to prevent sexually transmitted infection, like I stated earlier, in terms of the condoms, to prevent STIs, gonorrhea, syphilis, and the rest, over HIV. Okay, people also use it in terms of family planning to prevent pregnancy-related issues like anemia, bleeding, ovarian eclampsia, like high blood pressure in pregnancy. There are really there are cases where you have pregnancy-related issues, and by the time you use contraceptives as family planning, it can be used to curb or reduce those pregnancy-related issues. Also, it can also help the mother to be able to regain herself before the next pregnancy, so she can be able to get back to her normal shape, okay, in terms of her health also. And then also in family planning, contraceptive can be used to reduce mortality in children, like in cases of giving birth to low weight children and children that are malnourished. Okay, it can help to reduce that, and the children can be properly catered for in terms of feeding, in terms of education, and the rest. Also, in terms of contraceptive, like it can also help control population rates. Like in our country, Nigeria, you will not give birth to too many
people
children.
are exploding.
Yes.
People are giving birth because God will take care of the child.
Okay, so it helps control population. The natural resources can be allocated well and used well. Also, job opportunities helps to reduce the number of job opportunities available when the number of children are limited.
All right, Coach. Thank you for pointing that out, because what we see is that when we talk about contraceptive, people just look at it in the context of just pregnancy, right? Trying to prevent pregnancy, and not knowing that it has some economic benefits, like you've mentioned. The fact that contraceptive may help a mother to be able to plan her child or plan the number of children she has. So she as a person can stay healthy, the child can stay healthy, and maybe the family can stay healthy, because if the mother is sick or any member of the family is sick, the family is also sick.
Exactly.
Because it's taking resources and it's taking the rest. And also thank you for pointing it out that sometimes these medications may also be used to work or to treat other conditions, as the case may be, because I know these, especially in this our climate, if somebody goes to a clinic or maybe let's say a pharmacy, for example, and gets a particular kind of drugs or wants to buy a particular kind of drug that may be tilted into the contraceptive family, people just believe that you started doing something. Yeah. Sometimes, let's say if you're a married woman, they'll be like, I've started going outside, so you don't want if you're a single person, they'll be like, but not knowing that this can also be used to look at other kind of things. And I just want you to relate it, because we're trying to work in line with the Mother Body World Health Organization, seeing how we can put things in place. How does contraceptive help to achieve SDG3, the Sustainable Development Goal 3, that has to do with health and well-being?
Oh, okay. That Sustainable Development Goal that was established by United Nations. Okay. There are about 17 in number, but let's just stick to the ones relating to contraceptives. Okay. Let's talk about the SDG3, the one that have to do with health and well-being. Okay. Like I stated earlier, you have to talk about the health of the mother, also talk about the health of the child also. Okay. So it helps the mother, like I said before, it helps the mother to be able to regain herself before the next pregnancy. In terms of maternity, pregnancy-related issues, hemorrhage, like loss of blood, anemia, preeclampsia, that's BP in pregnancy, it's really causing a lot of mortality issues. Like pregnant women die because of all these pregnancy-related issues. So, as a way of relating contraceptive to SDG, that's the health and well-being, it helps to reduce that. Like a case where you don't have to give birth often and often that way, it can help you to stay healthy as a mother. For the children, like you will not be malnourished. The child, you don't need to give birth to a child who is low low birth,
Weight.
malnourished, and you also have ample time, ample resources to able to cater for those children. They will look healthy. So the SDG3, as established by United Nations, contraceptive related to it in this aspect in terms of maternity health and the health of children.
All right. Thank you so much, because if we step outside, we see it around in our communities where a mother is with like 7 children, and each of them is like 6 months older than the next one. So the mother is holding one and one is holding the other, and they're just walking. And most of the, you see, like you said, those children are very, very malnourished, because one, and the mother too looks malnourished because it's putting a whole lot of strain on her. Yeah. The husband too looks malnourished. The neighbors may look malnourished because these children will start to pick from the neighbor's food and the rest of the thing. And this is how it does. That is why contraceptive becomes an option, so that we can, like you said, the Sustainable Development Goals. Contraceptive is one of the things that help to achieve health and well-being. Because if parents and mothers and fathers can space their children, they'll be able to, first and foremost, give birth to children that they can take care of based on their economic resources. And then also they'll be spacing, and it doesn't put the mother's life at risk. Sometimes you see a woman, 5 years she's appeared in the maternity ward.
Also, it also helps to prevent all this premature pregnancy. I know when there's premature pregnancy, it can lead to unsafe abortion.
Yeah, and complication.
Yes, complication and sometimes death.
Oh, that is nice. So it's better that you prevent a pregnancy that you do not plan for. So at the beginning of the discourse, you talked about drugs, surgery, and devices and the rest. So most likely that points to the fact that when we say contraceptive, it's not just one thing. So what are the types of contraceptive that we have?
Okay, I'll basically classify it into 5 major classifications.
Okay.
Let's start with the barrier methods. Okay, we have the barrier methods. Let me just list them out. We have the barrier methods. We have the hormonal contraceptives. We have the natural methods. We have the permanent one, like the sterilization.
You don't do.
Okay. So like the barrier methods, it's like the number 1. It's just like the name implies, barrier. It's a barrier between the sperm and the egg. It doesn't allow the sperm to get to the egg. And obviously where sperm doesn't get to the egg,
pregnancy cannot happen.
Yes, there will not be fertilization and pregnancy cannot happen. Okay, so basically you can classify them into 2. We have the chemical barrier methods and the mechanical barrier methods. Under the chemical, you can have the spermicides, those that kill the sperm.
They don't allow the sperm.
Do not allow the sperm exactly to live
killer
and fertilize the egg. Okay. So we also have the mechanical, where you have the condoms, both the male and female condoms. You have the diaphragm, which is a dome that is inserted deep into the vagina and do not allow the sperm to have contact with the eggs. We also have the cervical cap, which is similar to the diaphragm, but it's a bit smaller.
Okay, and it's placed like in the cervix.
Yeah.
Yeah, okay.
Yeah, inside the vagina, on top of the cervix.
Okay.
That's the opening of the uterus.
Okay, so that Oga's material does not pass to Madam's material. All right.
Yeah.
Okay, so because I love the way you differentiated it, talking about the barometer. You talked about the one that is chemically inclined, that has to do with the chemicals working on the sperm, for example, like the spermicides. Then you talked about the one that use actual physical barrier that stops it and be like, you're not going anywhere.
You're not going anywhere. The condoms. Okay. You're not going anywhere.
Yeah. So because I like the fact you pointed it out. So because most people, we see a whole lot of male condoms around. I'm still trying to figure out why male condoms, because we also have female condoms. Exactly. And it's always so funny that when you put out a female condom, you can carry a female condom and show a female. They'll be like, I don't know what is this. Like you mentioned diaphragm. I'm very sure that so many people have not seen a diaphragm before. Some people have not seen a cervical cap, the cervical cap before that prevents pregnancy. But these are things that are optional. I used to say this, especially for women. Sometimes you see women come with unplanned pregnancy and you ask them, why couldn't you just use protection? They'll be like, you did not want to use. Okay. Why didn't you use it yourself? There are condoms for females. There are diaphragms.
Exactly.
If knowing that you'll be the one to bear the brunt of the outcome of this unplanned pregnancy, if the mountain doesn't want to go to Mohammed, why can't you carry yourself and go to the mountain and help yourself? But that's it. Okay, so let's proceed to other forms of it.
Okay, we have the hormonal. There you can have, there are two classification of the hormonal contraceptives. We have there are other examples under hormonal, where you have the pills, you have the injectables, and you have the implants.
Is Postino under this one?
Yes.
That drug has seen
Postino is under the pills, hormonal birth control.
That drug has seen shege in this country. Okay, let's go.
Yeah, so you have the pills, you have the patches, the one that is on the skin, either on the arm or buttocks. Okay, on the back. Then you also have the injectables. I don't want to mention names. Okay.
And the implants.
Yeah, those implants that you can classify those ones under long reversible contraceptive. Like you can reverse them, but they have long action in the body, where you have the implants, you have the uterine, intrauterine devices. Then we also have the natural awareness methods. Natural methods, where you have the fertility awareness method, you have the withdrawal. Okay, then we have the Oga Patapata, the permanent one, where you have the you have to remove either the vas differential, or you remove the fallopian tube. Okay, then where you have the vasectomy for that of a man, and you have the liga litigation. Thank you.
Okay. So because thank you so much for pointing this out. There are going to be a couple I want you to hit on. Now, I want to start with this because there's a problem I've been facing in the as a sexual and reproductive health educator. I know there are so many different hormonal contraceptive, but let's mention this one, post-pill. The one that the most common one is like Postino. Let's talk about Postino. Like, I just want you to shed more light on, especially what it does and how it should be used. Because I don't understand why one of my neighbors, she might see this, keeps on taking post pills like on a daily basis. She wakes up in the morning and she uses that to wash her mouth. So please just throw light on that.
Many ladies feel post pill is the ultimate protection. Some of them just after I'll use post pill. You don't know that aside from preventing pregnancy, you also have to protect yourself from STIs. Post pill cannot help you for STIs. The only thing it can do is it can help prevent.
Maybe it's because pregnancy is seen, STI is not seen. you can scratch your thing inside the house, but you cannot hide pregnancy.
Sexually transmitted infection, it's something else.
Yeah, very
something else. When you want to treat it, it's something that is expensive. It's discomforting. The fact that you get to scratch, discharge, smelling, and all that.
Yeah, that's very true. And if you're just joining us, we have an episode on sexually transmitted infection, so you can go check it out. You'll get to know that it's not as funny as they make it sound. Okay, please go on.
Okay, so for the post pill, it has, you take it like it's something people take after having sexual intercourse, after meeting Odogun. After having sexual intercourse, and it has a way of preventing the eggs from being released from the ovaries. And when they're not released from the ovaries, sperm cannot meet them, there will not be fertilization, and obviously there's no pregnancy. So that's why most people take post pill after having sexual intercourse, to be able not for the eggs not to be fertilized by the sperm. Okay,
so it delays ovulation so that the sperm can come, dies off before the ovulation happens. And it's important to know that it's one of the ones that attacked emergency contraceptive. Emergency, emphasis on the word emergency. And something will be, be one do something without born, but it just happens, so you just need to take it. It's not something you should keep it and take it as a point of duty every morning. It's essential that you know that because it's an emergency contraceptive, everything used under emergency is always heightened than normal. So it contains more hormone than the other one, so that it can act faster. So if you take it on a regular basis, it can become more of a problem to you. We're looking at, if you should take it, it should be like once a month. It's not something that you should be repeating. But my neighbor will say, no, she's taking every morning. But I've been saying it to her, I've been preaching it to her, and we're hoping that the good Lord touches her heart so that she can change from that. So let's also talk about the natural method. Because I know people who tell me, and like, my church does not take drugs. Whether you like it or not, contraceptive is a form of drug. So for people like this, can you throw more light on the natural method? So since their church or their religious organization does not do chemical products, what they can do for
Okay,
themselves.
so under other natural methods, we have the fertility awareness method and we have the withdrawal. Okay, under the fertility awareness method, you can use the calendar, you can use your past menstrual cycles to be able to know when you have ovulation, when you're ovulating rather. Okay, so a woman doesn't get, she's usually fertile 5 days before ovulation, on the ovulation day, and 12 hours or 24 hours after ovulation. Okay, so when you use calendar to be able to predict when you are fertile, when you ovulate, you'll be able to know when
to
you are
meet,
safe.
or not to meet.
But it's not 100% actually.
Okay.
You have to be, you have to use it like 6 months consistently to be able to now know that to be able to know the exact time. Okay, so that's for calendar, using of calendar. Some people also use temperature. You know, when you're ovulating, it has a way of making your temperature high.
Yeah, I remember when I was ovulating.
Okay, it has the way of, okay, we also have the symptothermal, where you get to use all the methods, calendar, temperature. Also, you have to check, some people also check the mucus that comes out during ovulation. It's slimy and it's not like normal discharge, it's thick. Okay, so you can use that to be able to know when you're ovulating and to be able to know when you are fertile and when you're not fertile, to be able to know when to meet. So that's for the natural. You don't necessarily need to take any drug, just for you to calculate very well, calculate properly, know your cycle very well. So many people have different cycles, 26 cycles, 28, depending. Okay, so you'll be able to know when you're ovulating and know when you're fertile and when you're not fertile.
Oh, more that one will be for coconut head, like we know sabi calculate. Because if you don't know how to calculate, please stay away from that. And nonetheless, it's not that reliable method because things change. Your body's change. The stress you go through in your daily life may affect you and the rest. She purposely talked about the natural method that affect me and leave the men. So don't worry, I'll talk to my gender.
Don't worry,
I'll talk to my gender. So for the withdrawal,
your can do withdrawal actually.
See, it's a contraceptive method, no doubt, but it has the highest failure rate.
Exactly.
I'm not saying you should try this, but you see it on maybe like movies. Do you know what it means jumping out from a moving car? Do you know how much you have to time it to perfection?
Because once
even people that act, they have stunt directors around them that tell them when to time it to perfection, and then they review and they bleed. But it's not a method that you should rely on. It's not a method. It has like something percent accuracy rate, meaning that for every 10 men that use it, it will fail 3 men, and those 3 men may not be you, sir, may not be you. So, but it's essential that you know this and not to depend on it alone. That's how it should be. Condoms are quite available everywhere, so you can use that. So, because let's talk about long-acting and short-acting contraceptive.
Okay.
Right, because there's always this issue that people feel that if I use contraceptive, okay, let's say now I'm not married, I'm not interested in having a baby now. That if I use contraceptive now, I won't be able to get pregnant when I'm ready to get pregnant. So what do you say about that?
Okay, so the long-acting can have the intrauterine device, the one that is fixed into the cervix. It's T-shape, kind of.
The one they call copper T.
Copper T, exactly. It has this shape and it just enters deep into and stay there. Okay, so those ones, they're actually preventing the sperm from having contact with the eggs. Okay. Like once the sperm.
So like how long can they act?
Okay, so it depends. Some can stay in the body for years, depending on the one you are using. But when it deems fit for you to remove it, please quickly just remove it. But the one good thing about those ones is they stay for years. Some can stay for 5 years, some 3 years, over 10 years also. So can stay up to 10 years.
All right. So thank you so much for that. Now, because you said it will stay for 10 years, I'm a Gen Z. I'm a Gen Z OD, not a baddie, OD. So I know that in the next 10 years, I may want to have a child. So does this mean that, let's say I am using a copper T, right? 10 years plan is like a subscription. 10 years plan, copper T. Will it always act for that 10 years? Or is it that every time, if I decide that today I want to stop. I'm ready to get pregnant. I've met my grace and I want to remove it.
Yeah.
Will I gain back my fertility suddenly?
Yes.
Okay.
You can. The only one that you don't gain your fertility is the permanent one.
Okay.
The one that has to do with the cutting and tying of the
tube, whether the male tube or the female tube. So, but that reminds me, why do you think that is not a popular option? You really hear that?
So many people have side effects. Many people have side effects.
Like from the surgery of...
You mean for the surgery?
No, I mean like for the surgery. The side effect, is it from the surgery or is it from the procedure itself?
Sometimes it's from the procedure.
Okay.
Sometimes from the surgery, depending on how you meet to do it. Okay, talking about is it the permanent one you're talking about?
The permanent one, like tubal litigation and vasectomy. That's the one I mean. Okay,
so many people don't want to do that because they might want to get pregnant later. And once you do that, that's all.
Okay, wait, look at, because I'm saying this, I tried to convince my mom, right? My mom has had like a couple of kids, 7 precisely. But I know she's no more. And I've been trying to convince her and be like, do this thing. Everybody will just rest. Or sometimes you see a man and he's like, I'm not having a child again. Maybe I've had the required number of children. But tell this man to go and do this vasectomy.
Some people don't like doing that because that's the end.
Okay. People always want to have option in case something happens. Just
in case there is need to. Okay. It can be reversed.
Okay. So
but once you do the permanent one, it cannot be reversed. That's all.
All right. So, and that's one thing. And I think another thing I've heard some men say is the fact that because they're tying the vas deferens, they're talking about how it may impact on their actual sexual life. But the thing is, the vas deferens does not impact on your sexual life. It's still going to be, for my men that go 50 rounds, you can still go your 50 rounds if you want to.
That you cannot
the only issue is that your ejaculate will not contain sperm, meaning that you'll not be able to fertilize the egg, and that's just that. So since we've already started talking about some misconception, like in vasectomy, people thinking to stop their sexual progress. Let's talk about this one that is like the major thing. People have social media channels dedicated to this. Contraceptive and infertility. Please, does contraceptive have anything to do with infertility? Okay.
Well, it depends on the method. When you use other methods different from permanent, like the sterilization or removing of the fallopian tube or the vas.
That one leads to infertility.
That one leads to infertility.
Okay.
But every other method, once you remove the device or once you stop taking the drug, you come back to normal.
Oh, okay.
You can get fertile.
Say it again. While you're saying, you look at the camera, it's essential because I'm serious. People are having social media channels dedicated to these things.
Okay. So you can actually gain your fertility back when you use a method different from permanent method. It's only permanent method that can make you not be fertile anymore. Or other methods like the natural methods, the barrier methods, the hormonal methods. Once you stop using the device, once you stop using the pills or the injectables or the implants or whatever, you can gain your fertility back.
All right, because it's essential you say that, because you see people come out to say that they use a particular method and now they are not able to get pregnant. I think what people don't realize is that just like every other service in medical care, there are actually people that have been trained to provide this service. You can't, yes, we know that almost everything you take has a side effect, which is the truth.
Yeah.
The common analgesic you take, the paracetamol of the market, the anti-malaria in the market, they have their side effects. So is this contraceptive. But it's essential that as somebody who wants to use family planning or birth control, you go to a family planning clinic that people have been trained. There's even a family planning algorithm that looks at your unique needs. I think we'll come to that, and then we'll be able to choose a method for you. So what are the things you should consider? Or can anybody just take any contraceptive? Can I just wake up and decide I want to go and do an implant? Or do I wake up and say, where did they sell copper tea? Bring it, let me insert and put it there. Or are there like criteria, or are there factors to consider before you choose a contraceptive
there are different
option?
Factors actually, but the main factor is your health. You have to consider your health. Your health is your priority. What works for Madam A might not work for Madam B. Madam A can use implants to work for her. Madam B can use pills to work for her. Don't say because it's working for pills is working for Madam A, pills should also work for me. You have to consider your health first. You can also use your past history, what you've used before. Did you react to it? Was it okay for you before you can go ahead? Also, aside from your health, also consider the cost effectiveness. Some people that have money, cut your coat according to your clothes. Use your money based, like use the contraceptive that you can afford. First of all, look at your health first before the money. Use the one that your money can afford, the one that you can easily get accessible to you also. Then also consider if you want to get pregnant later. Like when you talk about the permanent own, for you to do that permanent own, just know that you have made up your mind that you will not give birth again. That's a long-term goal and a short-term goal.
As you just mentioned that even studio manager, I know they're happy at all. I know they're happy for that one because I know studio manager still wants to go on. But it's essential you point that out because like when you say talking about costs, if you know that you cannot keep buying condoms, for example, maybe you just have a boost of money now, you can go do an implant that will last. Exactly. Instead of you starting to buy condom and you can't buy it tomorrow and then you'll be going to your neighbor's house and knocking door and looking for. Some people even rewash condom and wear. Jesus Christ. Why must you do it? Why must you do it? People rewash condom, people repackage condom and reuse it. It's a one-time use. Some people make it look like clothes. You know, the funny thing is that they don't even know that condom has the right side in, you know, just like your clothes. So they wear this side today, tomorrow they remove the other side and they shake it and the things that happen. But it's essential that you know that when you're choosing a contraceptive option, you look at your health. That brings me back to that wheel. When you go through that wheel, when I was in the family planning clinic during my clinical practice, they put the wheel. There are certain conditions that are not good for people with certain health condition. Maybe if you have diabetes, for example, they'll be like, this may not be a good suit for you. If you have hypertension, for example, they ask you your family history. They ask you your medical history. Have you had surgery before?
Exactly.
Have you ever had a surgery on your womb and the rest of so that they consider this thing? It's not just for you to just wake up, go pick any contraceptive just because you have the money and you can afford it. And also accessibility, right?
Yeah.
And ease of use, because there's some contraceptive option that will need a professional.
Exactly.
For example, injectables. You need a professional to inject you. Except for self-injectable. And even that self-injectable,
you have to be very careful.
A professional to teach you how to use it before you use it. So you need to consider all those things. Does my health permit this? Is it cost effective for me? Is it available in my local area and accessible?
All these pills now that you have to take back to back
every day.
Yes,
so you need to make sure that it's something that if you need it, you can get it as soon as possible. And when you look at all these things, and also you look at, there's something that people don't look at. You look at your cultural and spiritual needs.
Yeah.
Does your culture allow it? It is something that you can make it obvious. You know, for example, if you use a contraceptive that somebody can see, will they badmouth you? Because if you stay in a place and you use a particular contraceptive method and the people around you don't support you, you're most likely not to follow through with it.
Some culture sees that taboo.
Yeah, so look at your culture. If your culture says you should use a natural method, you can go find a coach, a stunt director to help you how to jump out of a moving train. But on the whole, it's essential that you visit a professional whenever you want to take contraceptive. Now, we talk about contraceptive. I had an episode here where I was talking about sexual and reproductive health, right? I asked this question. Most of these contraceptive are for women. What have you people, apart from condom, what have you people done for men? What is the role that men have to play when it comes to contraception as a whole?
Well, so many men are actually against contraception, but it shouldn't be. Men can actually follow their women to seminars where they talk about family planning.
When you say so many men, all I do is look at the studio manager again. But it doesn't look like somebody who is against it.
Men can actually go for seminar, like where they talk about family planning, the use of contraceptives. Men can follow their women to go there. Men can also help the woman remember. We can remind them, oh, you've not taken your pills, like the birth control pills. You've not taken, they can remind them to take their pills. Those that requires going to the hospital to change, to remove and all. Men can also remind their partners that they need to go for a change to remove so and so time, like the diaphragm that you shouldn't use more than 24 hours. Obviously, they can remind them that you need to remove this. It's not something that you stay more than 24 hours. So men can remind. So when women can forget, so men can remind. Men can also talk about their experience, like their wife experience.
And tell it to other men.
Tell it to other men. Educate them
men.
That this is not a taboo. It helps you to be able to plan your children. It helps you to be able to plan the spacing between your children. It can also help when men are educated, when they follow their women, they're educated. you know all the side effects, like some of the side effects, though it doesn't happen to everybody. They're able to know that these are the side effects that comes with some of these contraceptives, so that even when their wife is experiencing it, they can easily know that this is as a result of the contraceptive and seek medical help.
All right.
Seek medical advice, seek medical attention.
Okay, so and also to add to that, if for whatsoever reason your wife cannot use a certain contraceptive option, as a man, go and use condom. Stop saying you like it raw, that you enjoy it when it's skin to skin. Help this woman to help you, because if she has an unplanned pregnancy, it's still going to affect you.
Exactly.
You know, we're looking at baby things now. I was watching a skit yesterday. Oh, more baby things cost though. Baby things cost.
Meal.
Help yourself. Help the woman and help yourself. You've already mentioned the next one I wanted us to get into, advocacy. You've talked about men being advocates. So are there other people that could play advocacy roles? Are there other people that could come in and ensure that the uptake and the access to contraceptive has been improved?
Yeah. With the NGOs can actually fund seminars. They can pay or organize health practitioners that will come and talk about contraceptives, come to talk about family planning, the importance of contraceptives, the importance of family planning. NGOs can also subsidize
the cost of some of these contraceptives.
They can also give it for free. They can give it for free, actually.
What of non-governmental organization? That's NGOs. What of GOs? Governmental organization?
They can actually. They can fund that. They can fund the they can share it over there. Over in NYC camp, they do share condoms, not because they are actually encouraging people to have intercourse, no, but to prevent all these unwanted
prevention
pregnancy.
is better than cure. Okay, so just before we go, let's talk about culture and religion as pertaining to this thing. What role does culture and religion play?
Well, some cultures are against it. They see it as taboo. They be like,
your culture. Does your culture see it as taboo?
So many cultures.
I'm just asking, like from your own personal experience, does your culture see it as a taboo?
Some parts.
Your part, where you from exactly?
Really, I wouldn't really know. It depends.
Okay.
Actually.
Okay.
It depends. Some see it as taboo. Some see it as you want to have something that will make you to easily go and have sex anyhow you want to. Some see it as a woman trying to
be promiscuous.
Exactly.
Okay.
Like, you can randomly just go and have sex since you know that you will not get pregnant. Some cultures are against it. Over religion.
Yeah.
Some religion are against it. They see it as a sin. Like, obviously, Bible say go into the world, increase and multiply, go and procreate, Abby. Some see it as why are you stopping this natural thing from happening?
Okay.
They see it as why are you using foreign
bodies to stop what God has already created.
So some religions are actually against it.
All right. I hope that a religion that is against it, that as you don't want to stop what God has created, that you are ready to fund what God has created, because it takes a community to raise a child.
Exactly.
I wish it still did, but now it doesn't, because back in the day, if you don't have, your mother may just sing now and be like, drop your neighbor house, then don't finish cooking. Maybe you don't hear the aroma, so you wrong go. But now, the kind of fence they are putting, all man for itself. So it's essential that you understand contraception. That is why we bring this conversation to you, so that you understand that there is a thing that you can use to plan your family, to help you live a better life as a woman, as a man, as children. The best form of contraception is and would always remain abstinence. Exactly. Abstinence prevents pregnancy.
100%.
Yeah, 100%. In fact, you don't need to be afraid. It has no side effect. That is the best form of contraception. Nonetheless, people will always be people.
Yeah.
And we tell you that if you must indulge in this, like what I tell people in my community, I tell them, avoid sex if you have no business with it. But if you think you have business with it, please protect yourself while you're at it. Protect yourself against sexually transmitted infection. Protect yourself against unplanned pregnancy. And we want to appreciate the amazing pharmacist Ada Kamalu, for sharing with us our knowledge today. So any last words for the viewers at home down there as it pertains to contraception? Okay.
First of all, contraceptive is not a sin. When there is need for it, like family planning, it's a joint decision actually, where you get to decide. You decide with your partner, either individually or together. So it's not a sin. You can decide to use contraceptive. Couples use it, individuals use it. Use contraceptive. Protect yourself against unwanted pregnancy. And please, don't just go and pick any random contraceptives and use. Make sure you seek the help, the advice of medical personnel. medical practitioner. Know your health first. Buy the one you can afford, the one you can easily assess when there is need to continuously get it again and all that.
All right. So like she said it's not a sin, except your religious organization say it's a sin. We're not asking you to go against a religious organization. But the Nigerian Constitution has also postulated that it is not a crime. So nobody's going to arrest you. If you have reason to prevent yourself from having unplanned pregnancy, please use a contraceptive. If you have issues trying to know, the only allowed over-counter contraceptive is the condom. Now, even the condom may not be favorable for some persons because some people have latex allergy because of the material used to make the condom. Nonetheless, there are also other forms of condom that is not made of rubber. That is why you need to meet your health professional. So if you have a spouse, if you have a partner, especially a man that says, I can't use condom, it used to make me feel somehow, take him to the hospital. They'll give him another brand that is not made with rubber and most likely will not be allergic to it. And if we do this, we stay healthy. We're going to help ourselves as individuals. This is if you're a male or a female, because unplanned pregnancy is going to tax you emotionally, psychologically, financially, and otherwise.
Physically.
Yeah, physically too. And we are going to help the children that we'll bring in because we know we have the resources to take care of them. Also help to space these children so that they stay healthy. And if we do this, everybody stays healthy. So this is what we bring to you today from the table of the Intimate Matters podcast, where we always share with you information that pertains to your sexual and reproductive health. Our aim is to ensure that we educate and we inform you to help you make informed decisions, make decisions based on having accurate and appropriate knowledge. And we know that when you do this, your sexual and your reproductive health will be healthy, and so will other aspects of your health be. Do not fail to engage with us on all our social media platforms. We are on Facebook. We are also on YouTube, and you can also connect with us on our personal WhatsApp group, as the link will be in the description. You come there, you can ask questions, you can suggest topics that you would love to hear on this podcast, and we will be glad to indulge you. I am your host, Nurse Akwa Okban, and this is me saying bye for now.